this learning session on supporting transgender teen and parent communication, crisis in the emergency department. Many teens come to the Children's Hospital of Philadelphia when they are in crisis because they know they will get the best care possible. Sometimes that crisis includes finding ways to talk with their parents about tough topics. In the following slides and with the accompanying video, we hope to offer you additional tools to provide this important support and care for our transgender patients. During this learning session, we will review some language around transgender identity. We will also review why it is important that we are creating a safe place where transgender youth can come when they are experiencing a crisis. We will also identify components that will be key in providing compassionate and competent care through the video example with a patient in our very own emergency department at CHOP. Let's start with some terms. Transgender and trans are terms that individuals may select for themselves when they have a gender identity that is not aligned with the sex they were assigned at birth. An example of this might be someone who is told they are a girl when they were born based on their body and genetics, and they do not feel that they connect best with being a female. They may actually feel much more like a male. Gender non-binary or gender expansive are terms that an individual may select for themselves when they have a gender identity that is not fully aligned with the sex they were assigned at birth, and they fit better with a combination or of gender identities and or expressions that may not be distinctly male or female. When having the pleasure of meeting with someone who shares that they are transgender, gender expansive, and or a term that you haven't learned yet, your best response is to be thankful for the information and respectfully ask what that means for the person and how you can best use this information in their care. It is important to appreciate that transgender and gender expansive individuals are an important part of our homes, our schools, churches, and communities. One study found that 0.3% of the population in the United States is transgender. In 2014, CHOP was awarded the designation as a leader in LGBT healthcare equality, which includes providing expert care to transgender and gender expansive children and youth. We have worked hard to continue to be a leader in this area with our care, our policies, and our support for staff. As a result, many transgender and gender expansive children, youth, and their families come to the Children's Hospital of Philadelphia for routine, specialty, and crisis care. Transgender children and youth can experience more depression and anxiety than their peers due to bullying and harassment in their schools, homes, and communities. While we have always known that parents have the ability to provide healing support for their children through many of life's challenges, a supportive parent in the life of a transgender child or youth can be life-saving. One study found that transgender youth who had parental support were 72% more likely to report overall life satisfaction than their transgender peers who did not have parental support. Additionally, these supported youth had a 93% decrease in thoughts and experiences of suicide. Because parental support can often be the best medicine for a transgender patient, we have prepared a video to help you see how you can assist in bringing teens and parents together to facilitate their own health and healing. Please take a moment to watch the upcoming video and focus on the role that matches the one you fill in the CHOP emergency department to see how you can be part of this solution.
Hi, Jacob. Do you remember me from last time?
I do remember you.
I'm Brie. I'm going to be your nurse today, and this is Katie, one of our nurse practitioners.
Hey, it's nice to meet you. Thanks for letting me care for you today. Since I'm meeting you for the first time, I always ask all of my teenagers, is there a name that you'd prefer I use or pronouns today?
Jacob is fine.
And then I think your mom is on the way, so I'll wait for her outside, okay?
Thanks, Brie. Okay, so before your mom gets here, there's a couple of questions I want to ask you. We really want you to be healthy and happy.
Sure, if you want to.
So your school nurse called me and told me that you fainted today because you weren't eating enough. I've met with some youth who share different reasons for not eating, and some of them think that it has to do with gender identity or sexual orientation. What's this experience been like for you?
What does it have to do with gender?
Well, some people are assigned a sex at birth, like male, but it makes them feel really uncomfortable on the inside. Have you ever had any thoughts or feelings like this?
Do you know what transgender is?
I do. We take care of a lot of amazing transgender youth here at the hospital.
I'm transgender.
Well, thanks so much for sharing this with me. Can you tell me a little bit more?
Well, everyone thinks I'm a boy, but I'm really a girl, and I want to go by she, her.
Thank you for telling me this. I really appreciate your honesty today. So, I want to ask you another question that I asked you before, and there might be a different answer this time. Is there a name that you prefer that we call you today?
My friends call me Amanda.
Okay, is it okay if I call you Amanda?
Yeah.
Cool. Okay. And are there pronouns that you prefer that we use?
They, them, or she, her.
Great. Okay. I'm going to write this down for myself so that I can remember. I'm going to share this with the team if that's okay with you.
As you can see, there are many team members and many components that help this youth to feel safe sharing important information with the care team. Our transgender patients have shared that they want to be asked about their name and pronouns, so please don't feel shy to do so. The possibility for making an error could come up, and you'll be ready to apologize if or when that happens. Here at CHOP, it is our patient care policy to use the name a patient requests from us. At times, that can be challenging if the parents or other family members are not ready to start doing the same. We will be as sensitive as possible in these situations, while also knowing that honoring a person's identity is part of their health and their healing. Please continue watching to see more examples of how to provide great care in this challenging situation.
So this is really good for us to know. So tell me, does your mom know about this?
Well, my mom's really unhappy about this, and she doesn't know about my friends calling me Amanda.
Okay. So you're telling me this today, and I'm wondering if you want some help from us to help your mom understand what's going on with you.
Yeah, I need help. My mom won't listen to me or my therapist, and it's just all getting worse.
What do you mean by it's getting all worse?
I don't want to look like a guy, and I don't want to get big. And since my mom won't help me get hormones, I don't like to eat so that I'll stay skinny and more female.
Well, that makes a lot of sense. So you're not eating because you want to look feminine and feel more feminine?
Yeah, it's kind of stupid.
It's not stupid, but I would say that it's getting a little bit dangerous. Today you fainted, which is letting your heart know that it's not getting the nutrition it needs to keep up. So I'm really glad you're telling me this, because I think that we can really start to help you. What made you feel safe enough that you could tell us this today, Amanda?
Well, you asked about my name and my pronouns, and people who know about this stuff know to ask that.
I'm so glad that I asked, and I'm really glad that you shared this with me today. So here's the plan. I'm going to go and talk to the team and let them know this information. You're going to see us talking, and we'll be talking about you, and we're going to come up with a plan to help your mom get on board. When parents aren't on board, sometimes we have to take baby steps. So since your mom doesn't know that we call you Amanda, she might use your other name. Is that okay if we use that name when we're talking to her?
Yeah, I think my mom's really unhappy about this, so you can just use Jacob with her.
Thank you. Thanks for your permission. Okay, I'll do everything I can help. Okay, I'll be back.
Thank you.
When you learn new and important information from a patient about their gender identity, it's important to ask how the patient would like this information to be used in their care. Some youth may want to keep the information between the two of you, while others may want you to share with the rest of the team. In this case, the youth wants to use the trust that she has developed with the medical team to share this information with her mom. It is important to practice with compassion and respect in these, as in all, situations. Please continue watching to see how compassion and respect, with the right amount of planning and teamwork, can move things in the right direction.
So I just got some really interesting information from the youth in room 10. We've all been taking care of this patient who we've known as Jacob, who's struggling with an eating disorder. But Jacob just let me know that he actually identifies as transgender and feminine and prefers that we call him Amanda and use she, her pronouns. I think this is really important because now she's identified that there could be a connection between her eating disorder and her gender.
Oh my gosh, I've totally taken care of Amanda before, and whew,
Great switch on pronouns.
I'm gonna need a little help though, so can you guys like look out for me? Make sure I apologize if I use the wrong name and the wrong pronouns.
Oh yeah, for sure. We'll all help each other out.
So there's another complication. It sounds like Mom doesn't know. Amanda really wanted us to know. And she has talked to her therapist about this and tried to broach the topic with Mom, but it doesn't sound like she's ready to support her on this level yet.
Okay.
That's going to be complicated.
We can totally figure this out. I'm going to get permission and we're going to call the therapist so that they can have a meeting and let the therapist know that Amanda has identified that there could be a connection between gender and the eating disorder. We really just need to help Mom get on board so that we can get Amanda the help that she needs.
So what do you think I can do to help?
Well, I think that you could add the medical piece, and since you know the family really well, do you have any suggestions?
Yeah, I think Mom is really supportive and really wants Amanda to feel better and to be more healthy. I'm just going to suggest maybe talk to Mom outside of the room first and just give her this information before we go into the room.
Yeah, I just don't think we can ignore the medical piece of this anymore because it's really starting to affect her. I mean, she fainted today, so.
Well, I can totally help with that. I think it would be better for me to go talk to Amanda just so that she knows that I know what's going on, maybe before Mom gets here, and then we can make sure that she's okay with us talking to Mom outside the room.
Great idea.
Great.
The multidisciplinary team approach offered here was vital in creating and executing a plan that was going to best help the patient and her mom. At each step, communication was key. Listening to the patient, coming up with a plan, assigning the tasks, and working respectfully together. Take a few minutes to think about the ways that the medical team worked together in this care plan. How would you fit into it best on your team? Also, take a few minutes to consider ways that you might ask for help from a colleague and or how you might correct a colleague when doing this important work together.
So hi guys, you remember me from your last visit. My name is Dr. House. Jacob and Janet, is that right?
Yes.
So Janet, I'm so sorry to say, I haven't had a chance to really sit down and talk to Jacob or do an exam yet, and I'd like to do that and ask some questions with you outside of the room. Do you think it's okay for me to ask you to grab a cup of coffee while we do that?
That would be great. I came here right from work. I could really use some coffee. All right, do you need anything?
We'll let you know as soon as we're finished. Thank you.
All right, thanks.
So hi, it's Amanda, is that right? Thank you so much for sharing that information with my friend Katie today. That's really, really helpful. Sounds like there's probably a connection with how you feel and what's been going on with your health. It sounds like the most helpful thing we can do today is really start a conversation with your mom. Is that right?
Yeah, she's just really unhappy about this, and every time I bring it up, she says it's a phase or that I'm copying my friends and won't talk about it.
Okay.
I don't know what is going to help her right now.
Well, I think maybe one of the better things that we can do is have Bree, your nurse, and Katie, the nurse practitioner, and I have a conversation with your mom, maybe outside the room without you, to sort of start some things. Would that be okay with you?
Yeah.
Okay. Well, then I'm going to go try to corral her when she comes back from coffee, okay? Awesome. Thank you.
So I alerted the therapist that a family session would be a good idea ASAP based on what we're doing here today.
I had a good conversation with Amanda. She knows that we're going to need to talk to Mom, and she gave us permission to talk to Mom kind of outside in a different room to start the conversation.
Okay, great. Oh, hi, Mom.
Hi.
Janet, right?
Yeah,
It's good to see you again. I'm so sorry you're here.
it's just frustrating. We've been through this so many times.
Yeah, I understand. I know this is very complex, and I know we just want the best for Jacob, as we all do. So I know you've met Dr. House already. This is Katie. She's one of our nurse practitioners. We're just going to ask you, do you want to talk privately in the room? We just had some more information that we got from Jacob today.
Sure.
Great.
Hi, Janet. It's really nice to meet you. I'm Katie. I'm one of the nurse practitioners.
Hi.
Thanks so much for coming in today and letting me join your team. You have a really incredible child.
It's been really frustrating. We've been here so many times and we just don't know what's going on.
Yeah, and we really want Jacob to get better as well, and that's his goal too. So I asked some questions today about the eating disorder and some gender. It sounds like gender is a topic that he's brought up in the past with you guys.
Not that again. He keeps saying he wants to be a girl. He is a girl. It doesn't make any sense. He's just following his friends and he watches all this stuff on YouTube and it's nonsense. We're not addressing it.
Well, you're right. Sometimes teenagers are definitely trying to fit in and make friends. But there's a new level of concern today because he told me that he's not eating because he wants to look and feel more feminine, like the female that he identifies as, and that can get pretty dangerous. So he told Dr. Heather and myself that he identifies as transgender, and that's part of why he or she isn't eating.
I know this can be a lot to take in, but I think we've known each other for a while now, and we just want the best for Jacob, and I think we all want his health to be in a better place.
So I did talk to Jacob too, a little bit by himself, and he was really, really happy to hear that we would all be having this conversation because we want everyone in your family to be taken care of and be on the same page.
I don't know what you expect me to do about this.
Nothing right now, except for love your child just as you've been doing, and this is just a new layer of information that we have to build a solution. So, we have to start identifying Jacob as a female, because that's how she identifies.
And here at the hospital, we have support of hundreds of families that go through transgender teenagers just like yours. And we also have a clinic that specializes in helping families and supporting.
So what, you expect me to give him hormones to be a girl and pretend that this is real?
We're definitely not saying that is what you have to do. We do want you to connect with professionals who know a lot about this and facilitate conversations between you and Jacob to take better care of him or her.
So we know not eating is just not an option anymore. We're seeing some major issues now with Jacob, and now we have some new information that's going to help us take better care of him.
I did call the therapist, and they're going to get you in as soon as possible so that you can have an emergency family meeting.
Is there anything else that he told you?
Well, Jacob did let me know that the friends at school call her Amanda, and that makes her really happy. And she asked us to call her Amanda here today, and she really wanted you to know because, you love her, and she wants you to help, and you want to help.
Okay, I'm not going to be able to do that right away. Not at all. But I'll try.
We understand this is a lot, and we're going to try to get through it together and try to take all this information and just let it sink in.
Thank you.
As you can see, the goal was to bring this parent and patient together to facilitate the best care possible. If parental support is the best medicine, this warrants our work to help in this area. Thankfully, the team approach that we utilize in the emergency department at CHOP is a perfect fit for this type of collaborative, multidisciplinary care. And the modeling of respect, compassion, and care for transgender children and youth can go a long way in showing parents how this can be done. Thank you for joining in this learning session, and we hope that you can put these skills into action in the next few days.